All right, is everybody comfy?
I'm comfy.
You comfy, Sajil?
I'm a too
You
comfy.
comfy on
bro.
us? We should call this the Comfy Podcast.
No. Why do we keep changing names? It's not easy to make those posters, okay?
All right, fine.
All right, it's better.
All right, now that we got that over with, welcome back, North Court Podcast.
The North Court.
The North Court Podcast.
What's your verdict? What's the verdict?
What's the verdict? Don't
We're
forget
still
the
getting a
duh,
hang of it, eh?
right?
We don't even know the name.
Right. Welcome back for your host. I'm your host, Raheel,
With the most.
with the least.
With the-
Anyways, I got
Sajil.
with me.
I'm Anas.
Osama.
Welcome back. Welcome back. It's a fun Monday night, 8 p.m. 8 p.m. Toronto, Ontario, Canada. There you go. So 8 p.m. on a Monday night. It's not a regular Monday night. Let's be honest.
It's pretty warm, man. For November?
It's mad warm for November.
Pretty warm?
It's warm.
It's a little too warm.
No, I'm enjoying it.
So yesterday we went to Barrie. Well, three of us, me, Sajil, and Usama.
Thanks for the invite.
Yeah, no problem on us.
We don't have room in the
You
car, man.
uninvited yourself. We
What do
did
you-
have room.
I think I called you. Didn't
I don't think Osama knows how cars work.
Anyways, we
That's
went
a
to-
different conversation.
We went to Barrie. It felt like summer. Everyone was out downtown Barrie. Families, kids, people in shorts, tank tops. I'm like, what's going on? It's summer.
Feels like summer.
and we were by the
It feels
water.
like summer. It feels like summer.
California.
I almost
girls.
forgot that was like November.
We're undeniable.
But yeah.
My bad.
But the other thing that surprised me was, being in Barrie, I didn't see a single mask. How many masks did we see?
The 4 that we had on.
I know. I think
That
that's
was
it.
it.
We just saw our masks.
And that's why I didn't want to take mine off.
right, because I think like the Ontario numbers are crazy,
Yeah.
right,
Yeah.
for the coronavirus.
Theirs is lower though. Maybe that's why.
We're talking
Probably.
Ontario.
What region are they? Halton?
No.
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 What region? Because their region is like minimal.
I don't even think they show up on the stats because
Yeah,
they're
'cause-
so small.
Because they don't have any
Yeah.
people to get COVID.
Yeah.
I mean,
Okay,
we
yeah,
definitely
I-
seen people there. So
I think the only place we did
Like-
see masks were actually restaurants where it's it's enforced,
yeah,
right? So if the employees don't have it on, then it's like bylaws and whatnot.
Did they card you guys?
They didn't card us. Why would they card us?
Like I remember there was some news that if you're from Toronto, some people might not serve you.
Oh no! There was none of that.
That's
There was
not in
none of
Barrie.
I don't think businesses are really going to try doing that.
that. Yeah. As long as we had our masks on, I think nobody really cared. But other than that, like, no carding, nothing, just people free, out and about. I think
So it felt
Yeah.
like there was no COVID.
Don't say it.
it feels like there's
I
no
didn't know you was going to
COVID.
say it.
No, but it felt like that like
yeah. It
was
felt like
life was back to
for
normal.
them. Yeah?
That's how it felt
Yeah.
for you guys? I felt scared.
I felt
That's
kinda
because
scared
you're
too.
in a different mindset.
I felt scared. I was like, damn, I got to get out of here as soon as possible.
I know. That's why I was worried. I was like, why are there
And
so many people?
I
with no
couldn't take my
masks?
mask off at all.
Exactly. I don't get it. Maybe it's a different attitude because as soon as we got back here,
Yeah.
my
Masks everywhere.
Masks everywhere. People on the street. Nobody's near them. Still, they're wearing masks
Yeah.
because Toronto's hit heavy
Heavy.
Cases
heavy.
going up every day, man.
every single day.
It's not even slowing down. Like
We're hitting record numbers.
Yeah,
Yeah.
we're in
Every
the
day.
thousands. Our average is 1,000 now.
1,100
Yeah, that's crazy.
per day, and I think we average in Toronto 300 to 500, something like that.
Around there.
About half.
Yeah,
A
with
quarter
not
to
more.
half.
majority
if
of the
not more.
cases are here.
Yeah, so Barrie was quite normal compared to Toronto then.
I don't know if you'd call that normal. I felt out of place, but
I felt out of place. I mean, anywhere outside of Toronto, I feel out of place.
But as
Yeah.
a Barrie citizen,
You're not
you
a
would-
Barrie citizen. Who's a Barrie citizen?
no, I'm just saying like as a
Oh.
Barrie
Oh.
citizen, that would be like normal for
yeah,
you.
like for them, it's like there's no COVID.
Yeah.
If you live there, I guess like you wouldn't feel it at all.
I don't know if we can speak for them.
I don't know, man. Barrie's a weird place.
Yeah,
Anyway.
exactly.
I apologize if you're listening and you're from Barrie. I'm not a
It's
fan.
getting better.
I'm not a fan. It's developing. It's made a lot of progress in the last 10 years. There's no place like Toronto, though. Let's be honest.
Of
Right.
course.
This is home.
This
T-dot.
is home. I feel out of place
The
anywhere
6.
else. The 6, exactly.
6. Summer 6. Okay.
Devil's numbers.
So that
Yeah.
brings us to the question. What's our question today?
Go ahead.
will life ever get back to normal after COVID, or what is the time span? And once we conquer COVID, like once we defeat COVID, will our mindset be the same, or will it get back to life before COVID? You know, no masks, people will be like touchy again. In terms of like, you know, friends, you know, you say hi or what up to people that, like, I know people still within your circle, like you would still hail them up because you trust them, right? I think everybody has a group of friends during this COVID nightmare.
The bubble.
Their own bubble, yeah, their mini bubble that they chill with, and with those people, they're comfortable without wearing masks and, you know, be close within 6 feet and talk to them. And
yeah, we saw a lot of that. It's it created like a new phase of like hangout. The parking lot.
Yeah.
The parking lot outside your trunk, you know, on the hood of your car.
With the chairs.
With
the lawn chairs.
Some people brought out lawn chairs, patio chairs,
Yeah.
right? Set it up in
They
a
were
parking
chilling.
lot.
It was a vibe. It was a vibe.
I think it created pretty good memories for a lot of people.
I loved it.
I loved it. I miss it.
I actually miss it. I think
Yeah.
COVID really like opened up some weird but really memorable moments.
Yeah. It was interesting, you know,
Yeah.
like a lot of us thought, you know, this is gonna like ruin our social life. We're gonna have to stay away from people. and-
Yeah.
But we adapted really fast.
I mean, that's what the media made it seem like, right?
Right. I mean, that's their job, right?
I guess.
Let's
yeah.
scare people so they keep watching, so we tell them, here are your tips. Here's how the you know,
The CDC recommends.
exactly. They're
Yeah.
trying to, you know, keep you watching, but that's their job, whatever. But as people, like, you know, not paying attention to the media or whatever, you sort of managed it on your own. The initial stages were what? Stock up on food.
Oh,
Yeah.
the initial panic.
When there was no toilet papers,
No toilet paper.
no sugar, no rice, no Lysol,
No pasta.
nothing.
My pasta was gone.
I don't know about you guys, but like I stocked up a lot on water, and of course, like I don't know why my parents like panicked about that, but like now I'm not having to drink like bottled water at home to finish it. But,
You
like,
still
Ruining
have-
the environment.
Do you still have water after all these months?
yes,
Bottles of water? That's wild.
Just-
you guys overreacted
I don't know.
like
Yeah,
crazy.
my parents were like, "Yo,
Overreact.
water's gonna shut off or something." Like I don't even.
There's like a water so there was going to be a water shortage,
Yeah.
a toilet paper
Because
shortage.
no, like people were buying water too. Like, you know, a lot.
I
like,
think
in stores, like you wouldn't.
Yeah, in the initial stages, there was a lot of panic and a lot
Yeah.
of misinformation about the virus because
Right.
realistically, we didn't know much about it, and to this day, they're still learning a lot as they you know study it more.
Right.
And I think a lot of people thought that maybe it would infect the water supply, and that's why they were like stocking up on water. But the toilet paper thing, I do not understand. Like, guys,
No, people thought they were going to be locked in.
but
Like,
why do you need that much toilet paper?
I don't know.
It doesn't make sense.
Well, I mean, if you're locked in at home, then stores are shut down. You're not allowed to leave. I guess it makes sense. And then
No, it doesn't.
for them, it does.
Just
right?
take a shower. What are we
Or-
talking about?
Or just use water.
Like we all do.
I mean, is that where the bottles come in? I guess.
Yeah.
Just use water.
I guess so. You buy water instead of toilet paper,
Just take a shower. You're at home anyway.
or take a shower. You have more time now. You're all at home,
And now all of a sudden you're cleaner.
and you're cleaner.
Or invest in a bidet.
Invest in a
Oh,
bidet.
bidets are magical.
How expensive
I
is
could
a
talk
bidet?
about bidets forever.
How expensive is a bidet? Oh, you experienced a lot of bidet action in Korea.
Whoa.
Right?
Pause.
What's wrong with that? Bidet action.
That sounds kind of sus.
What's not sus? You experienced bidet action. What's sus about that?
Why are you making it seem like
I'm not making it seem. You're making it seem like
you're
that.
making it seem.
You're making
kinda
it seem
sus.
like that.
It's
Who's
kinda-
making it seem like that?
It's kind
I
of.
think the both of you guys.
Did you or did you not experience bidet action in Korea? Yes or no?
Yes.
There you go.
I enjoyed it. Yo,
Oh
it
my
was
goodness.
Okay, let me tell you, man. Just a quick before we get back into it. Yo, bidets are magical. Okay, it's like it knows where to shoot in the right spot every time.
So the bidet in
Pause.
Korea was
Yeah.
like built into the toilet.
Yeah.
It wasn't like a hose hanging off the side.
No. That's not a bidet.
That's
That's
not
a
a
shower,
bidet.
man.
No, that's not a shower because people have those where the toilet connects to a hose and,
And then
use
you
a
use
hose.
a hose.
Yeah,
Yeah.
it's,
You-
and that's referred to as a bidet as well.
It's referred to as a
I
bidet
don't like
as well.
those bidets.
I think those are French bidets, maybe.
Those are like the manual bidets. I like that automatic joint.
Well, Korea's advanced, right?
Yo, they had that pressurized system.
Yeah.
That pressurized joint. It was a 5-speed setting.
5
Oh
speeds?
my
Why would you
God.
need 5 speeds?
What do you mean? For all
You
for
trying
all
to-
situations. You know, I'm lactose when I had some milk.
All right, I think we need to get
That's
back into
enough.
the
Alright.
topic. We're getting a little too
Let's
detailed.
get back to the virus.
They're
Okay.
not that expensive
So
now.
where
so
were
pick one
you?
up.
Where were you when you first heard about the virus coming to Canada, or like becoming global?
Oh man, it was crazy. It was like within a span of a week. Actually, the first situation when we all thought that, you know, this is real, this is happening, was when the NBA shut down. And that was because Rudy Gobert of the Utah Jazz, he contracted COVID, and then they stopped the game,
Yeah.
and
There was that infamous video
of him touching the mic.
touching every
Everything.
mic,
Yeah.
touching people.
Yeah, and then Donovan Mitchell got it, and then that's when they shut down, the NBA right away. They shut it down. They had
Right.
no games for the rest of the night, and then NHL shut down, and then slowly it trickled down to like everything.
Yeah.
And even my work, got delayed because of
Right.
the initial panic.
Right.
It got delayed by like a couple weeks
Yeah.
until they figured out.
That was what, late March.
March 13th, I remember the
March
exact
13th,
date.
mid-March.
Yeah.
Damn. And then, here's the thing. Here's the weirdest part for me. Some guy at my school, he's a Iranian fellow, and Iran got hit
Hard.
hard right after China had the initial outbreak.
Yeah.
Then,
And then
Iran had the outbreak. And
Europe as well.
And yeah, Europe was as well. And we maybe it won't come here. He was telling me the week prior that, this is going to be global. I know people who were in Iran just before the outbreak, and they're here now, and they're experiencing like symptoms.
Yeah.
They're being hit by the coronavirus. They're coughing, they're sick. And he's like, it's here now. And he said to me, I'd recommend you stay home this week.
And I don't even think testing was a thing that early on.
No, it wasn't.
It wasn't.
It was just severe cases where you had to be hospitalized. And
Exactly.
Yeah.
They didn't even know what was going on.
They
Yeah.
put you on a what is it called? A ventilator.
Ventilator, yeah.
Oh yeah, and there was like a shortage of those as well.
That was the scare, right?
Yeah.
Because your health unit, your public health unit, it's not designed for an outbreak like that. It is
Exactly.
designed, but a controlled outbreak.
Controlled outbreak.
It's
Yeah.
not
A
designed
global
for a
pandemic.
global pandemic, nationwide pandemic, where it's like thousands and thousands of cases. It's not designed for that.
And the thing is, respirators, like especially the ones that are needed for a COVID patient that's experiencing
Shortage of breath.
shortage
and
of
stuff.
breath and like really bad symptoms, those are expensive, and they're not easy to get in a short amount of time. So if you're running short, those people that can't, like, they have to cycle ventilators, and that's what was happening. And I think when America started to get hit really hard, like the eastern states in New York, they were in a really bad position, like 7,000 deaths per day.
I mean,
Per
they still
day.
are, man.
No, but like New York, I'm talking New York controlled it really well.
Uh,
The state of New York, they really toned it down. But in their peak, they they didn't know where to bury bodies.
Aren't they at their peak right now?
No.
Yeah, that's.
New York is really controlled now.
You're talking about just New
Oh,
York?
just
or
I'm just
New
talking
York.
about New York, but yeah,
Okay.
US is peak cases like 130,000.
Yeah.
I think yesterday
Yeah.
Just
they were at
yesterday.
140K
Hey, they're
in one day
number one in the world, right?
for
Yeah.
everything.
For everything, good and bad.
Yeah, mostly the bad.
Yeah.
But that'll be
you
later.
guys, Anas and Usama, you guys have siblings in the States right now, right?
Yeah.
Yeah.
How are they dealing with it?
I'll let Osama answer.
Okay, so my sister.
Oh, yo, your
Um,
sister's funny,
My
man.
sister is hella panicked.
I mean,
Even
why
now,
wouldn't she
even
be?
now.
Even now, because the cases there are not going down, right? It's
But
just-
where she's at, is it better or worse?
Where's she at?
No, it's
Are we gonna disclose that?
Middle of nowhere, America. I mean, you can tell the state. Say the state.
Yeehaw!
Yeehaw. It's a yeehaw state.
I think it's a yeehaw state.
it might be a yeehaw state. Is it a yeehaw state?
Do you know what a yeehaw state is, Osama?
no, I don't.
Sweet home Alabama.
It's like
Oh, okay.
it's like
Like Barry,
Barry. Think about Barry.
countryside.
Okay.
Think about Alberta. Think about Alberta.
Like countryside, not
Okay,
as
okay.
not as advanced.
Well, I don't know if you would consider it's Missouri. I mean, not Missouri, sorry. Chicago, sorry.
Oh, that's a big
Yeah,
town
yeah.
city. Bro.
Missouri to
big time
Chicago.
city.
My bad.
Oh, Missouri is definitely a
My bad.
yeehaw state.
Yeah, that's what I got it
Yeah.
confused because of that. Okay, yeah.
Chicago, Illinois.
But,
Chi-town,
But yeah,
Chirac.
like
R.I.P. King Von.
cause yeah, overall, okay, so I guess it honestly depends on your like personality too. She wakes up and like the first thing she does is like check on the COVID case.
I think that's what we all do.
We all
check
do
on
that.
the COVID. And the
We
COVID.
all can
and,
relate.
Like,
Yeah.
there, every day the cases are going up.
Right.
So,
Yeah,
like,
especially lately.
therefore she just every day she's just freaking out more and more. It's not really like getting better.
Well, she hasn't has anyone near her been exposed to it?
Not directly near, but I mean you can't really predict either, right? Like you don't really when you go out outside, you don't really know. But when you're looking at 130K cases, you don't really know who has it.
Yeah, especially
Right, like-
because the U.S. is so vast
Yeah.
and they're so spread out.
Right. Except the main cities. Like
Like
Chicago's
here,
a major city.
Chicago's a major city.
Like
yeah.
here, we're getting like a K cases and we're freaking out,
Yeah.
thinking it's
Yeah.
a lot, right? But
Yeah.
if you legit,
Because we're freaking out because it can flip, right? It can easily flip into more and more cases.
yeah, because we're looking at the states.
No,
Yeah.
because
I
we're
mean, I don't
looking
think we'll
at-
ever get to that level,
Okay.
hopefully. But
Hopefully.
Well, I
like,
mean, our population isn't
Hopefully.
as
Yeah,
big
we're
as
looking
theirs.
at 4 million people in Toronto though,
yeah,
and 500 cases
uh-huh.
in a population of 3 million, 4 million. That's scary.
Definitely.
That's scary.
I think she's like reasonable to be scared, but I mean, she is overreacting.
Yeah, you can't let it
Yeah,
consume you. That's where I differ with a lot of people.
Yeah.
Honestly, okay, in the beginning I was kind of worried, but I was also living by myself because my parents were back home, and I was more worried for them because Pakistan is my birthplace. It's still like a third country developing into a first world country,
Right.
and they have the facilities, but obviously not to the point where like a Canada would have it, a European country.
Yeah.
And I was freaking out. I'm like, man, my dad, I know for a fact, my dad hates staying at home. Like he loves going on walks, especially when he's back home. Like he knows everybody, he's chill
Right.
with and that's his time to be out. And I was always calling them. I'm like, hopefully we can get you back home because flights weren't operating as well.
Air travel was canceled.
Air travel was canceled. Their flight kept getting delayed.
Air travel. Can we talk about that a little? Air travel is open at the moment, right?
Now it is. Yes.
Now it is.
Now
yeah.
it is, right?
Basically free flying.
Would you still like? How safe is it?
They're pretty good at making sure the air is circulated, checking people, prior to the flight, right? In Canada,
I think they
They-
check your temperature.
they have these measures in place.
Yeah.
Of course, they're not 100. Like they're not foolproof. Everyone's wearing a mask
Mhm.
except for kids.
Like
Yeah.
the reason
Young
I'm
kids.
the reason I'm asking that is like as we speak, my sister, she's working on a plan to go back home at the moment.
Yo, the
that's
thing
a-
is,
it's like-
it's traveling is not as scary as it was before, right? As long as you keep your distance
Mm-hmm.
and you follow
But you
the
can't really
procedures.
keep a lot of distance in a flight, right? Like
No, but you can,
It's
in
like-
terms of like, obviously try not to chat, keep your mask on, wear gloves if possible, and don't touch your face. That's like the main areas where you get
Wash
infected.
your hands when you can.
Yeah,
I
wash
think
your
they're-
hands.
I think they're finding
Have a
that the
hand
masks
sanitizer.
are pretty effective.
Pretty effective.
They're like
Huge.
really effective
Yeah.
now, right? And before there was a debate like no masks, this mask, like what?
Before there was a point in time,
Yeah,
even when I didn't even wear masks then, because they were
Right.
saying that masks don't really do anything.
yeah,
Mhm.
Right,
But, like
and-
I didn't understand that. Like this mask is blocking my airways,
Yeah.
right? It's filtering my air somewhat. So why wouldn't it work? What's the science behind that?
There's no droplets
I don't
Like-
get that. So nothing's hitting my face.
Yeah.
and nothing's leaving.
Nothing's leaving. It's hitting the mask on the way out.
Yeah.
So how am I not safe?
You'd think that it's like a simple answer, but obviously, they'd have to do more research and figure it out.
I
And
think
I
it
think
was-
that's where they lost a lot of credibility
Right.
because, initially they were like, oh, don't wear masks. It's not necessary. Stop
Yeah.
rushing to buy masks. And then all of a sudden they're like, wear masks,
Yeah.
everywhere, wear masks.
How much are masks going for now?
If you're getting the regular non-surgical ones, I've seen it go for as low as like $7 for 50.
For 50.
But you got to get lucky. Some places will
Right.
mark it up for
Yeah.
$13.99 or something.
We were at Shoppers
Yeah.
about a month ago, I'd say,
Right.
and we saw, well, I don't know, it was a 50 pack, I believe,
Yeah.
and I think it was what, $30.
$30.
Yeah, but Shoppers is a premium.
I think the
location.
Walmart does that too.
Walmart
Walmart,
does it
Walmart
too.
as well, but
Yeah.
I mean, I think those were they the medical masks?
They were. I think they
Yeah,
were
I
like
think
the
they
white.
were- The
all
blue.
whites. Oh, the blue. Yeah,
The
yeah.
Because there's off-brand ones
Right.
that are like non-surgical and they're not guaranteed. They do that just to like save their asses.
Right.
But the medical ones, regardless of location, they're gonna have a premium because they have more guarantee and they're made with, I guess, stronger material perhaps, and it's more of a tight fit. The medical ones are more of a tight fit.
So now that we're figuring out, like, masks work, they're pretty effective.
At least we're figuring that out.
I mean, okay, Canada's figuring it out. Let's say Canada's figuring it out.
Yeah.
Right? One country. Do you think we're closer to opening up and just living with the virus?
Yeah.
Like mandatory masks everywhere, in schools, in restaurants, in workplaces.
I mean, if you look at it every day,
go back to work.
If you look at it every day, it's getting closer to that,
I think it is.
right?
I mean, it's
Every day-
basically opened up.
Yeah, exactly. That's what I
Basically
mean, right?
opened up.
Every
Yeah.
day they're finding a way to continue to open up something else, right?
Right. Even as cases go up,
Exactly.
the provincial government's going,
Okay, we can wear a mask there. You can wash your hands. You can social distance. Let's
Yeah.
open it up.
exactly.
You know what it is, though?
Yeah.
You know what it is? I think the government is right in its place when they open things up. I don't think necessarily opening things up is correlated to higher cases. You know why? I think it's because people are becoming more relaxed,
Right.
right? Like I believe, like, if you follow the guidelines where everybody's wearing a mask, or the person that you're talking to is wearing a mask, and you use hand sanitizer and stuff,
Right.
then the risk is minimal. Especially if you haven't talked to them for more than 15 minutes or been in close proximity for more than
Right.
15 minutes. It's minimal.
Right.
Almost like none.
I think as we open up, like, there should be options for people going to work where you don't have to be there. There should be the option. Can you stay home? Yes. I think a lot of business managers are noticing that people working from home is kind of better than them commuting. Not in all situations,
Not in all situations.
but in some, they're saving a lot of money in terms of office rentals, right?
Definitely.
they
and
might
then-
also lower wages though, which I hate. I hate that
Well,
they're
I haven't
thinking
heard
of
that.
that.
If you
I haven't
work
heard
from
that
home?
because recently the wage went up. to,
No, not the minimum
like-
wage.
Okay,
Like
just
for
people's
Just people's, like, salaries and
yeah,
whatnot.
like now they're saying, because you're working from home, there's less expenses.
okay.
like commuting expenses. So
Yeah.
they factor that out. And some companies are actually go by, oh, where are you living? Oh, your cost of living is lower. Okay, so now we can reduce your wage
Based on where you're living.
based on where you're living.
Oh wow, I didn't know that's happening. Okay.
That does
They're
happen.
thinking about it. I don't know if
Like-
they're implementing it yet. Some
'Cause,
companies
like-
are gonna cut back.
They
Because the
are.
thing is,
Yeah.
it's like it really shouldn't be happening because we have that standard of like equal pay for equal work, right? I don't think it has to do anything with where you live. It's just like if you're
It
working.
shouldn't.
No, it
It
does. It
shouldn't.
does though. It does a lot. Like
It
if you're living in the middle of but all nowhere, right?
That's actually how they determine your salary in the first place.
Yeah,
From where you live.
yeah.
Yeah.
Like
They go,
the cost of living in a country like not a country, in a city like Toronto
Mm-hmm.
is way higher than if you were to live in like Alliston, Ontario, which is like probably half, even less, right? So they're gonna factor in the wages accordingly.
right. So when you're looking for a job,
Mm-hmm.
the amount that job pays here in Toronto is different than it pays in Saskatoon. It's different. The amount's different in Calgary for the same job, based on the living expenses or the average income of that city, right? And it should be skill based, right?
Yeah.
That's what you'd think, but it's
Mhm.
not.
But it's not.
It's more of a necessity base.
Yeah.
If I'm in a smaller town, does my cybersecurity need to be as tough as somebody in Toronto? Like, does somebody even know my website exists? So obviously you're gonna pay that person less.
So in that
regardless of
sense,
their-
I guess it's a bad idea to move to a smaller city in terms of pay.
If you can work from home, it might be. It might be. Right.
But
Okay.
also like if you're living in a place that's a smaller town, the costs are gonna be relative to living there, so the income's gonna be relative. So it doesn't really make a difference.
There's a reason San Francisco has the highest salaries for tech jobs.
Bro,
There's a reason.
insanely high.
because
That's the hub.
The housing markets are crazy. The housing market's crazy there.
Yo, it's like $5,000 a month for a garage
That's wild.
in Silicon Valley.
That's wild. And they have to match that,
$5,000.
right?
That's a mortgage.
They literally drove every normal working person there
out of there.
out.
They're like,
Right.
get out. 'Cause
Everyone who works like a normal job in San Francisco is like
they don't work there.
they have to commute in. They have to commute from like Oakland or somewhere else
Yeah.
to get there. Yeah, I think so. So there's vaccine news today, right? Which everyone tweeted about.
Everyone's going crazy.
Everyone's going crazy. 90% effective. The anti-vaxxers got loud today as well, but we won't talk about them. We won't talk about them.
Man, that's another topic. A
Yeah,
scary
that's
topic
another
for
topic.
sure. But yeah,
No.
like they're coming out with some promising news that 90% effective.
90%. What does that mean? What does
who's
that mean?
Who came out with it?
Pfizer.
Pfizer and another company, BioNTech or something.
Right. But what is it? What's the 10% not effective?
I think the reason is like because it's still like early in it, or even later on, I don't think anyone's gonna promise 100%.
You can't.
They'll go to 99.
They'll go to just like
Yeah,
hand
like-
sanitizer.
Exactly.
They'll
Lysol.
go to 99.
So like
but they won't
in
go
that
to
sense,
100.
like 90 is pretty high. If they're gonna go to 99,
90 is pretty
90
high.
is pretty high. Like,
It
think-
is, but I mean, I don't think they're done the final stage testing.
Probably not. It's not. We're not going to see a vaccine out to the general public at least until next year.
They said early 2021.
That's their goal, but you know it's not going to plan out like that.
Yeah, usually.
Especially with like how many they have to mass produce this thing.
Exactly.
It's going to be hard to distribute it.
Yeah, that's one thing about humans.
Yeah.
We are very bad at predicting,
Yeah.
mhm.
like timelines, especially.
As good as we think we are, we're really bad.
We're the worst predictors. We're terrible at it.
Yeah, like you want to please the general public, but realistically, in my eyes, I think possibly mid to late next year. I don't want to be a downer or anything, but I think that's when we'll see the turnout of the vaccine. A lot of people, I think that, but the thing is also we'll see more than one company come out of it with a vaccine, not just.
Yeah, I think like once the door opens, it's like as soon as like one,
Yeah. A
one
lot of
gets
people are
approved
making
or
it,
whatever,
yeah.
then like they'll like take ideas and stuff
Yeah.
from them and
Yeah.
like come out with a second one or whatever.
yeah, or maybe they'll collectively agree that this is the one,
Reproduce it.
and then
Mhm.
they'll make it together,
They'll probably release the patent, right?
probably.
Yeah.
Right,
And then just
have-
get royalty off of it.
You would want
Yeah.
them to, right?
That's the
They're definitely
ideal.
going to,
Yeah.
but how much they're gonna charge?
That's probably going to be ugly.
Medicine is expensive.
I hope it's not like the insulin case in America.
Oh no, that's like 10 times the price.
What they sold it. We sold the patent. Banting sold the patent for
But then the thing
$1.
is, it's like, does the cost on this really matter? Like, wouldn't the government pay for its?
Not in some places,
People?
right? Like in America, you don't have free healthcare, so you're not gonna get it unless you get insurance or you have it or you pay it out of pocket.
I
But
feel like
obviously
this is-
here we'd be able to get it, yeah.
Uh-huh.
But it would be like off of a certain, like they would roll it out in phases, just like because they might not have 30 million vaccines to go around, so
Mhm.
they'll
They definitely don't.
yeah, so they'll roll it out, and some people might not even do it, right?
Get it? You mean?
Anti-vaxxers?
Oh,
Yeah.
okay. Yeah, and the other like interesting thing is like, where do you start with it, right? Like, who gets it first and who gets it last?
That's gonna
and,
be
like,
tough.
is this-
That's
Whoever
gonna-
pays for it.
So
What do
you're
you
saying
mean?
it's gonna be free for everybody, but if you pay for it, you get it first?
No, I'm saying. Oh, you're talking about. Are
In
you talking
Canada, I'm
about like
in
countries?
Canada. Yeah. In Canada, for example,
countries,
is just
The countries that pay more will get it first. So U.S., Canada, any
Mhm.
first world country
We'll probably get it first.
will get it first. Third world countries will look to the UN, right, for their supply.
yeah. Unfortunately, third world countries
And then
might
what
not
about-
see it until 2023, 2024.
Individual
Wow,
Canadians will
okay.
be rolled out by province, I'm sure.
yeah.
So Quebec, Ontario, BC, and then they'll work with, because I think it's a provincial matter. It's not a federal matter
Uh-huh.
on how it rolls out. I think it'll be all curated by the federal government and distributed to the provincial, and then the provincial deals with how they're gonna distribute it.
Yeah, their public health systems. yeah.
Exactly. So it'll probably hit Toronto first, right? It's
Oh,
I think
that's-
it's more by severity.
So being 90% effective, what's the
I don't know what
outlook?
that means.
No, but like 90% meaning that at 9 out of 10 patients saw
be cured?
like
Yeah.
a positive impact, or like they were cured, or they didn't get infected.
So how does the vaccine
afterwards.
work? Vaccine is you're attaching the virus or a dead version of the virus to a protein and introducing that, or an inactive virus
No, I think
to a
it's active.
protein.
Yeah, I'm pretty sure it is active.
It's an active
not.
strain, or maybe like a weaker strain.
No, it's not.
No, it's not. It's not.
It's inactive.
Okay,
It
then
has to be inactive.
I don't know much about this.
It has to be inactive so the body is able to produce antibodies for it.
Yeah.
And then in the case you get an active one later on, your body already knows this is what I need to
fight it off.
That's
or
insane.
prevent it from, having a major effect.
So
Yeah.
do you guys think like that life will ever go back to normal? Or like how long are we looking at? Or like,
Bro, I'm keeping a mask on forever.
Well, go ahead.
Yeah, I don't think it's a bad idea. Like, I mean, we've looked at the numbers of the yearly flu.
Yeah, that's
Oh,
what
that went
that's
down.
Exactly
It
what
went
was-
down. So,
yeah.
like, I mean, probably not as strictly as we're wearing the mask right now, but I'll definitely keep the mask on, but in more moderate ways.
Right. Like subway, I mean, when you're taking the bus,
Exactly.
public transit, going into, like a stadium or something
High
like
populated areas.
that. Yeah, they do that. Where do they do that? They do it in Korea.
A lot of Asian countries wear masks when they go outside, but that's mainly not because of like germs or anything, but because of their air quality. Yeah.
Right.
Yeah. They have some pollutants going around
Mhm.
because of China's air quality. It spreads to the East Coast, to Korea, to Japan, Thailand, and I forgot what it's called. I think it's called red sand or something. And it really, like, there's days where it'll be really high and they have an index for it.
Oh, right.
Yeah. And then it'll like be a warning on your app, like, oh,
Yeah.
if you have lung conditions, severe lung conditions or asthma or something,
Right.
then try not to go outside today or wear a mask.
We're pretty lucky where we live, eh?
Yeah.
Like, we don't have to, look at that. Like, oh, how's the
Air
air quality
quality.
today? Let me see.
Yeah.
I don't know if I
was
should go
looking.
out.
I used to do that a lot. Like I found myself looking at the air quality every day. Like, oh,
Right.
today's 80. On the index, that's pretty high. I should be careful.
Right, well, I mean, back to Salma's question. Will it ever go back to normal? How will it go back to normal? To be honest, I don't think that's I mean, you should worry about that question a little bit.
I think eventually, like
eventually,
it'll
I think it'll take years.
But I think it's going to be a new normal, right? As they've touched on this topic here and there, that
Right.
will it be the same normal as we knew it, or will it be a new normal?
Yeah,
Right.
like you're not gonna be willingly shaking hands with people that you don't know.
Exactly.
It's not gonna be
Like,
a thing anymore.
I'm going out. I see a friend's friend. I'm not going to be shaking his hand.
No.
I'm definitely not shaking
I'm
his hand.
gonna say what's up.
Yeah.
And
That's
I'm going
it.
to take a walk.
Respectfully disagree to shake hands.
Yeah, I'm gonna say what's up. What's your hand out for?
Yeah.
Get away.
Yeah. And definitely not sharing food. I don't think we're gonna be sharing food for a while.
I don't think we're going to be doing it at all anymore, to be
Yeah.
honest.
Like we used to share food all the time,
Right.
Somebody had leftovers. Oh, you don't want it? I'll take it.
Exactly.
Now it's like, oh, you don't want it?
take it home.
Take it home. Which is fine, but sometimes you're kind of hungry.
Yeah. So what's the verdict?
The verdict is life will be, like Sajil said, it'll be a new normal. Some people will eventually we'll eventually get back to it. But if we're talking about regular, classes, full classes, 300 people in the class, or like concerts, or, just large gatherings, I don't think that's going to happen for maybe a couple years, at least until the vaccine has been rolled out in its entirety.
And it's
And you see the
successful.
results, yeah. Like
And it's successful, and you see results. But even after the vaccine, some people will still choose to wear masks. But yeah.
I'm sure we'll have like many episodes about COVID. Like, welcome back. We're still in COVID.
It's an ongoing thing, right?
We started this podcast because of COVID, right?
I know, that was the whole reason.
Something to do while we're bored and locked up in the winter months. But let us know what you think. Subscribe, give us your opinion. We love to hear your opinion, any feedback.
If you want us to touch on any other topic,
Follow us on Instagram, give us a DM, and we'll definitely look into that for you.
the North Court podcast.
Yes. On every major streaming platform for podcasts.
Yes, Apple Podcasts, Google Podcasts.
Spotify.
I'm not gonna go over it. The link tree's in the description. If you're on YouTube, and if you're on Instagram, it's in the bio. Thanks for listening,
All
guys.
right. That's a wrap.